Welcome to the DentiMax Tip of the Week. With the release of DentiMax 2013, one of our major focuses was on taking your office completely paperless. And so a lot of the doctors have really gravitated towards some of the paperless features like the fully integrated imaging feature where you can view your x-rays within the charting screen, or perhaps the auto clinical notes, or maybe even electronic prescription writing. But one of the overlooked features for going paperless is the patient journal. A couple of ways of accessing the patient journal. You can click on Activities and go down to Patient Journal, or simply just click on F11. Now, the patient journal is a wonderful feature because it's kind of a catch-all. You can use it for all the other stuff that you couldn't think of in advance, all those word things that you want to record and keep track of. Let me show you what I mean. And so within the software, let's say perhaps we're in the ledger screen, and we'll pull up David Arnett as our patient. And we notice that there's an outstanding balance for over $1,200. We do some research and find out that Delta Dental never paid on that. That was mainly owed by the insurance. So we might want to resubmit those claims. Well, you probably want to make a note of that. And so the patient journal might be a place where you would record that kind of a note. Or it could be something where the patient, you can then really anticipate. The patient's moving. And so you're in the patient's record. You might want to go ahead and press F11 and add another note. You can right-click in this area, insert date and time, and you can say patient is moving, or David Arnett is moving on, maybe it's November the 5th, 2013. Put your initials on there. And so the patient journal, again, is kind of that catch-all paperless feature. For any of those things that you could anticipate that come up, you can go ahead and record those notes in your patient journal, and then later on have quick access to that, either from the ledger, the patient screen, or really anywhere in the software. So you can quickly review those notes and be prepared as you work with your patients and your insurance companies.